Hello there. Just wanted to quickly run you through a market-based patient share of care sample that HSG, as we engage with a number of our clients around to understand the total spend for a patient population within a certain geography, and what does our capture of that volume look like from a revenue-based standpoint. We're going to be able to first understand what does the overall volume look like within the market, where we might have an $8.5 to $9 billion sized market based on the patients within it, and then we may be capturing about 25% or roughly $2 billion of that to our organization. Now, there may be some small partnership captures that we may have based on joint ventures in the markets, whatever it may be. Then being able to understand what does that look like by individual payer classification, so commercial or governmental, fee-for-service, Medicare. What does our percentage look like, where we can see what's the relative value that's coming from a revenue standpoint from each of those separate payer classifications, and what does our capture look like, where we see we're about 22% for governmental, as high as up to almost 28.5% to 30% for commercial patients. Then being able to understand how does that differ by specific facility, so whether it be inpatient, outpatient, physician office, other ambulatory healthcare facilities. Comprehensively, what does that relative volume from a dollar standpoint look like, and what is our capture of which we're going to be able to see we're capturing, up 32% of the inpatient volume, as high as 36% for hospital outpatient, but then really lagging behind kind of in the physician office aspect of things, and understanding the relative dollars that are flowing through each of those separate sites of care and facility types within our markets. Getting the specific hospital detail, well, maybe we're looking at just the top 10 locations from a hospital outpatient perspective. How are we performing from each of our separate sites of care? What do our competitors look like? And how is that ranking? Maybe we want to do the same thing if we click on the right, be able to look at how does that differ for inpatient facilities. So now looking at just the inpatient aspect of things in those sites of care. What does our share look like? What are our top locations? And then what is the expected reimbursement or revenue that we would anticipate coming and flowing through each of those separate locations. We want an organizational dashboard that tracks all of our core service lines, so cardiovascular to emergency, other outpatient E&Ms, whatever it may be. What's the relative value of those from a commercial and governmental and other standpoint, from a overall dollar perspective, and then what does our capture look like over time, and how's that trending, so that we're able to kind of have that one-page snapshot of understanding what's the relative value and volume of the market in general, and how is our capture trending over time. Being able to maybe call out some specific priority service lines, trying to look at the same thing for those priority service lines, our capture and the relative volume of those. Then we'll want to get into some very specifics, maybe within orthopedics, for example, where we're able to see how is that orthopedic service line trending specifically. Once again, who are the top locations and entities in which those services are being provided for all orthopedic services, inpatient, outpatient, physician office, etc. There's many other service lines that we'd be able to have similar views on. And then lastly, getting into sub-service line aspects within, once again, just orthopedics. Now, joint replacement in orthopedics, as you would expect, is the highest dollar value trending over time, and our capture, how is that trending? And then once again, how is that, shifting quarter over quarter, depending on the time frames we're looking at and the relative volumes we see for orthopedics. We have joint replacements, sports med, the diagnostic component that's being associated with it from the outpatient perspective. So kind of layering all those different ambulatory inpatient aspects together in kind of a comprehensive dashboard to understand how we're trending in the market. If you have additional questions, would like a demo specific to your organization, or talk through the specifics, please contact me, DJ Sullivan, Director with HSG. You can contact me directly and we'll set up a time to touch base. Thanks and have a great day. Bye.